There is no health without mental health.
It matters to all of us.
Particularly coming out of a pandemic that has placed extraordinary stress on the entire world.
Youth suicides have doubled in the last decade.
1 in 5 adults are experiencing a mental illness, like anxiety or depression.
Many adults struggle with substance use, including alcohol and prescription drugs.
When a person has a mental health or substance use condition, it can limit their ability to work, to parent, and to really enjoy their lives in the community.
The behavioral health and IDD system in North Carolina has been stretched and catastrophically underfunded for decades.
We have no choice but to invest now.
Medicaid expansion allows North Carolina a once-in-a-generation opportunity to improve the foundation of care.
So every child and every adult in our state can get the substance use disorder and mental health treatment that they need.
When and where they need it.
With the passage of Medicaid expansion, North Carolina will receive $1 billion, yes, that's right, $1 billion bonus from the federal government.
The governor and NC legislators have developed a plan to invest this funding in the behavioral health system.
We must see this enacted.
We all want every child to grow up healthy in a safe, nurturing family and community. We get what we pay for. In North Carolina, over half of children with mental illness receive no treatment. And North Carolina has ranked last in the country for children's access to mental health care. 1 in 5 high school students in North Carolina have considered suicide. We must invest in solutions for children and families that meet them where they are in our communities and schools. We need to invest in more mental health services and supports for children in schools, in primary care, and through telehealth. We need to invest in more safe and stable homes and treatment options for children involved in child welfare with behavioral health needs so that kids are not living in emergency rooms. And we need to invest in the child welfare and child behavioral health workforces. We can work together to help every child and family experiencing adversity cope and heal.
Everyone needs access to mental health and substance use supports. We need to ensure we have a strong system and also enough access. That begins by increasing the rates we pay for behavioral health care. This investment ensures that we get the best qualified professionals coming into the public system. And it means we improve our access to routine mental health and substance use treatment in every North Carolina community. Right now, because of chronic underfunding, our system is in crisis, and that means individuals end up seeking care for the first time in emergency departments. Not only do we need better access to prevention and routine care, such as walk-in clinics, treatment in schools, treatment in primary care clinics, we also need a crisis system that is designed specifically for behavioral health. That starts with 988. In July of 2022, we launched 988 in North Carolina. It's just like 911. It's phone, call, and text, and it is staffed by trained professionals in mental health, so they can help with mental health crises, and they can also help people find resources in their community. We need to continue that investment in 988 and ensure that it also has community resources for referral, things like mobile crisis teams. Currently, we only have about 30 teams for 100 counties, so we need to build more. Mobile crisis teams are specifically trained mental health responders who can come to a person's home or a school or a community and help manage the crisis and help a person get local supports. So it ends up diverting the person from ending up in an emergency department. But sometimes individuals do need to go to the hospital. They need psychiatric hospitalization. So we need to make sure that we have enough psychiatric hospitalization available. First, we need to support the staff who work in our state-operated psychiatric facilities. We need these resources to operate at full capacity. We also need to adjust reimbursement rates for our community hospitals so they can build behavioral health units just like they build medical units.
Serious mental illness affects approximately 15% of men and 31% of women in jail. Around 85% of the prison population has a substance use disorder or was incarcerated for a crime related to substance use. But we can treat these issues before law enforcement is forced to bring an individual to jail. And we can help individuals thrive in the community post-release. We do this through diversion programs that treat substance use or mental health issues without sending someone to jail. Through re-entry programs that help individuals successfully return to the community after incarceration. Through programs that restore mental capacity so defendants can resolve their legal charges without substantial delays. We need to stop criminalizing mental illness. This includes how we transport individuals for psychiatric treatment. We need to fund alternatives to riding in a police car.
All of these solutions require a strong behavioral health workforce. We won't have that workforce without substantial investment.
Many systems that safeguard people's health and well-being are at a breaking point. By enacting the $1 billion plan, real progress is possible.
Investing now will make lasting change to our behavioral health system and positively impact the lives of millions of North Carolinians.